Good morning. Good morning, everyone. Thank you so much for joining us today for our live with Chris Aiken. We do very much want to say thank you for joining us today in order to talk about this definitely amazing certification that's offered through Evergreen Certifications, the Certified Mood Disorder Professional Certification. Chris is one of the advisors on the board for this particular certification, and he's going to talk to us about this particular cert. For anyone who's interested in learning more about this certification, please scan either the QR code that's here, or you may go to the link that you see here at the bottom of our page, evgcert.com/Aiken CMDP. So to go ahead and get started, my first question for you, or want you to go ahead and get started, Chris, by introducing yourself to our audience. I would just a little excited and just want to get to these questions for our audience, but please, if you can, introduce yourself and let them know who you are and what you do.
Yes, I'm Chris Aiken. I'm a psychiatrist, and I'm also the editor-in-chief of the Carlat Psychiatry Report. In my practice, I run a large mood disorder center called the Mood Treatment Center, where we work to bring new medications and new therapies together for people who haven't gotten recovery from
Mm,
traditional ways of healing, like SSRI antidepressants or CBT psychotherapy. And so that's what's exciting about this course to me, is it gives me a chance to speak about all that we've learned from the updated research literature and how to translate that into better health for your patients with chronic mood disorders. That's really what this is
mhm.
about. People who've lived their whole lives with some kind of depression or bipolar.
Absolutely. Awesome. Thank you for all that you do. And thank you for supporting us in developing this particular certification. So, my first question is, why should a professional get certified as in this particular area as a certified mood disorder professional?
The main reason is that you're probably seeing these patients in your practice. I think most of us understand that depression is a very global term that encompasses a lot of people, from a regular psychologically healthy person who just moved to a new city and gets depressed because they're disconnected from friends, to
Mhm.
someone who's had cyclical winter seasonal depression, and someone who's had bipolar their whole life since the teenage years. So
Mhm.
many different types of depression. And
Mhm.
what we're doing in this course is taking a certain type that's been recognized by psychiatrists and given different names: manic depression, bipolar, chronic persistent depression, but that has a origin in childhood or teenage years and tends to persist with people throughout their life.
Mhm.
And why not just keep doing what you're doing and use cognitive behavioral therapy or other therapies for them? Is because we have developed new psychotherapies that address the underlying problem better. This is an illness that is very biologically driven, but that doesn't mean that it gets better with medication. We are frustrated with
Mhm.
medications getting it better. A lot of the biology is actually addressed through psychotherapy. I'm talking
Mhm.
about things like circadian rhythms, inflammation, and
Mhm.
changes in the default mode network, which
Mhm.
affect rumination. So, well, if you
Mhm.
see clients who ruminate all the time and they can't get their mind to turn off and they're constantly worrying and negative thinking, there's a new type of therapy that's been developed for that, rumination focused CBT. And
Mhm.
we see great benefits for people with chronic depression for that. So, in this course, basically, you would learn some more advanced techniques that are going to help, not maybe they're not for all of your mood disorder patients, but for a big majority of them, they're going to be able to help them in a new way.
Thank you for sharing that. And that leads into my second question here. Um, Clinicians often treat, as you said, individuals with depression or other mood disorders. What is it about this particular certification, the standards within this certification, which of course will need to meet for a person to obtain this certification? What does it offer that's different, that goes beyond the typical treatment that clinicians will offer their clients?
Well, two things, and one is more advanced therapies for chronic recurrent depression. So we're talking about most of them are behavioral therapies on some
Mhm.
level, which help these patients further than traditional CBT. And some of those therapies, just to name some names here, are cognitive behavior therapy for insomnia. So addressing the insomnia in behavioral ways makes a big
Mhm.
difference in mood. We thought of this as a treatment for sleep, but it turns out in 12 controlled trials, it made a big difference for mood.
Mm.
Behavioral activation. This is a
Mhm.
therapy where you really focus on what they're doing and what it means to them every day
Mm.
of their life. And it's had bigger effects in severe depression.
Mm.
And rumination focused therapy, and even nutritional therapy. We used to think that what you eat didn't really affect your brain, but in around 2017, a series of 3 controlled trials came out showing that just getting people to change their diet, and they developed a simplified Mediterranean diet for depression, had a
Mm.
big effect on mood. It was twice as effective as general therapy. So
Mm.
these are all kinds of physical things in the way people are living their life, from morning and how they wake up to how they go to bed. So these are the behavioral components that can help depression. The other thing that you would get out of it is around the late 1990s, we
Mhm.
developed the first effective psychotherapies for bipolar disorder. And
Mm.
recognizing, we used to think of bipolar as a rare disorder that was bipolar 1, but with the
Mhm.
advent of bipolar 2, which really looks like chronic depression, most people with bipolar 2 don't look like bipolar at all, but look like chronic recurrent depression. These psychotherapies have grown, and I think the therapists need to know them because these patients are very common.
Mhm.
About 1 in 30 people have some form of bipolar. So if you look at a
Mm.
psychiatric practice, it's about 40%, and a therapy practice, about 20 to 30%.
Wow.
So learning these therapies, which in the course we build primarily on social rhythm therapy, which is
Mhm.
helping these patients align and regulate their circadian rhythms through having regular interactions with people and regular exposure to light and darkness. So we talk about
Mhm.
devices they can use to create sunrises in their room,
Mhm.
eliminate the blue light at night through what's called dark therapy. Some of
Yes.
our audience may know about light therapy for depression, so we now have dark
Mhm.
therapy for bipolar mania. And dark therapy helps sleep as well. So, one backbone to this whole course is understanding how circadian rhythms influence mood. The other backbone, I would say, is understanding the psychology of all of this.
Mm.
I'll just say, when you've lived with a mood disorder your entire life, you don't have a healthy baseline to draw from. So just
Yes.
working psychologically with the patient is very different as well, understanding their family interactions, and we have a section on working with family as well.
Mm, absolutely. This is extremely profound to hear all of what you just described here for our professionals that may qualify for this particular certification because like you said, so many people have this particular diagnosis, and it's not just one therapy. You just listed over five just a while ago. So I think our viewers and other individuals that would be interested in this will really, really benefit from it. So leading into my next question, what professionals is this particular certification for?
I think anyone who works in the mental health field can benefit from this. Certainly, psychiatrists work with a lot of these patients, nurse practitioners, and if you're doing brief therapy, like half-hour visits, we have a lot of tools that you can bring into those sessions.
Mm-hmm.
And anyone working in therapy, whether on an inpatient unit or in a private office or a public sector,
Mm-hmm.
is going to see these kinds of patients. I'll also add, people who work in the substance
Mm-hmm.
use disorders. There's a huge overlap of mood and substance use disorders, and we talk about dual
Absolutely.
diagnosis, and these tools are going to give you a meaningful way to help the mood side of that dual diagnosis. In fact,
Mm-hmm.
substance use disorders, people with those problems have even more circadian rhythm
Mm-hmm.
abnormalities than mood disorders do. So we found that very effective for them in maintaining their sobriety as well.
Awesome. 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 Thank you. My next question, after the initial year of being certified in this particular area, a renewal is required in order to maintain the certification. Why do you think that is so important for them to maintain their knowledge in mood disorder treatment?
This is a field that's always changing. So, just one change since I developed the course is that we used to think of the social rhythm part where you're getting
Mm-hmm.
doing things at regular times and regular wake times, regular circadian rhythms, was mainly for the bipolar side. Well, just in the last year or two, there's been two large controlled studies where they applied that to regular depression and saw
Mm.
a big difference. So we now know we got to help people with depression align their daily routines as well to get them
Mm.
better. So
All right.
that's the bottom line. It's always changing. The dietary stuff is very new and moving more toward probiotic foods. So a lot of
Yes.
changes there to
Mm-hmm.
learn and keep up with. Besides just the fact that you want to refresh everything you learned. I would say it's been exciting to work with therapists in this course because they start to feel like this is really speaking to clients that other therapeutic courses have not spoken to. And they
Mm.
light up and they see how they can bring it and it makes sense to them. We talk a lot about how to differentiate the different kind of mood disorders like
Mm-hmm.
mixed states and unipolar depression and cyclothymic disorder and how it affects personality. And they start to see how people that they may be understood as just having a personality disorder have a strong mood component to it as well and how it all works together because with these patients we're talking about when we're talking about chronic mood disorders comorbidity is the norm. Rates of trauma are like 70,
Mm-hmm.
so rates of bulimia are very high. So
Mm-hmm.
it just gives you another lens to look at these patients through. And I would say
Yeah.
it's a lot of new material, it's a lot of new learning, and annual renewal would make sense given all that.
Absolutely. Thank you so much for that. As you said, there's always new developments, research is always happening. So we need our professionals obtaining this certification or holding it to stay abreast to all of these new findings so that their practice can definitely stay top notch. And our final question for today for you, Chris, why were you so passionate about helping to develop this particular certification, the Certified Mood Disorder Professional certification?
Well, 50% of people with bipolar disorder and a lot of people with depression as well don't ever go to treatment. And
Mm,
I've always taken that to mean that they don't like what we're doing for them. They don't
mm,
feel understood by us. Now I'm going to backtrack to my early days in my 20s. I was in the art scene and involved in literary magazines. And unbeknownst to me, a lot of my friends had mood disorders and they were not going to treatment. So I
mm,
got to know them, you could say outside of the office setting, and gotten to listen to them and see how they
mm-hmm,
do their world. And basic things like sleep and diet and regular activity, these are things that they really saw as central to their recovery that weren't getting
mm,
addressed as much as in therapy or with medications. So it was exciting for me to go through this and see all that pop up in the research is like, whoa, that really makes a difference. So what this course has meant to me is bringing something new to people who suffer from chronic mood disorders
mm-hmm,
and have not achieved full recovery that they deserve with either medications or therapy.
yeah,
I'm convinced we can do more for them. And
mm-hmm,
I see it in the research. I don't see it being taught in general graduate school that much yet. It hasn't filtered down.
mm-hmm,
And personally, I believe that we ought to have graduate training in this like we do for
yes,
substance use disorders, because we all know you can get a license in substance use disorders
right,
population. So my message is this is also a unique population. They have a unique
mm-hmm,
psychology, a unique
yes.
biology, and there are ways we can meet their needs that we haven't been doing so.
Thank you so much. That's so profound. And I think that speaks to actually one of our questions that came in. It's a parent who actually indicated that she has a daughter who has been dealing with the mood disorder, and she has never seen a specialist in this particular area. So I'm so happy we're doing this today so that people can learn more about this and be able to know how to find providers that can really support their family members and even themselves. So I will take the liberty to answer this particular question as a representative at Evergreen Certifications. On our website, you can go and one of the tabs up at the top, it says Find a Certified Professional. If you click on that tab, you will be able to see individuals that in your particular area for whichever certification. So if you're interested in finding someone that is certified in this particular area, you indicate that, you put in your zip code, and you will see the individuals in that particular area. So for all of our professionals, people need you in this with this particular certification. So hopefully this helps individuals to understand what this particular certification offers and how they can go about obtaining it through one of those lovely courses that you described here today for us, Chris. Thank you
Wow,
so
thank
much.
you. I get that question at least once a week from various people, so I'm glad to have that response.
Mm.
Thank you.
Absolutely, absolutely. So that brings us to a close for today. I really enjoyed my time with you. Again, if you guys want to check out how to obtain this particular certification, please go on this particular link, evgcert.com/Aiken CMDP, or scan our barcode here.